Hello, in this video I'm going to explain one of the key aspects of the medical licensing system in Australia that normally confuses international medical graduates. And that is why you need a job offer before you can register as a doctor here in Australia. Hi there, Dr. Anthony Llewellyn, the career doctor. Consider me your medical HR geek, here to help you out on YouTube, Facebook and LinkedIn. So, the mechanics of exactly how you can get on the medical register here in Australia is one of very many things that is confusing about the medical system here in Australia if you're not used to it, i.e. you're an international doctor. Especially this issue of needing to have a job before you can obtain registration. And it kind of makes sense because probably where you are right now, if you were to apply for a new job in your own country, one of the very first things your potential employer would check is whether you have the appropriate registration or licensing to do that job. And that in fact is also the way it works here in Australia. Once you already have your general or specialist registration, you will generally be required to prove this as part of your next job application. But the fact is that if you are a doctor from outside of Australia, whether you're coming via any of the four pathways to practice medicine in Australia, i.e. the standard pathway, the competent authority pathway, the specialist pathway, or the short-term training in a medical specialty pathway, then you will not be able to register with the medical board until you have an appropriate position to go into. There are absolutely no exceptions to this rule. And the key reason for this is that the medical board needs to check that the first initial job that you are going into is appropriate for you and in particular has the right supervision. It's part of its responsibility towards patient safety. Now, if you're thinking, well, this is treating international doctors differently to Australian doctors, well, you'd be right, but with good reason. Once you've obtained general or specialist registration in Australia, whether you are a local graduate or an international graduate, you are considered to need less oversight and to be able to work independently and recognise your own limitations. Most IMGs who get a job and get provisionally registered or limited registration do eventually gain general or specialist registration and are then on the same footing. And in fact, even Australian doctors, when they graduate, cannot just simply apply to the medical board for registration. They have to prove that they've been offered an intern post, after which they are also given provisional registration for 1 year, prior to being able to apply for general registration. And I'm betting that in your country, for the most part, there is a similar system in place for newly graduated doctors. Okay, so you now get that it's job first and registration second. But what about all these doctor jobs that are advertised where the selection criteria states must have general registration? How can I get a job and then get registered when all the jobs say I have to have registration already? Isn't it a catch-22 situation? No, it isn't. You see, those jobs that state you must have general registration are not the jobs that you should be applying for. If you look hard enough and you look long enough, you will eventually find jobs where the criteria is changed to something like eligible for registration. And if you want to know more about identifying appropriate jobs, then I will link a video I've done on this topic in the description below. Or you may want to take my course on either the competent authority pathway or the specialist pathway, links also in the description below. So, how did I go? Did I help you to understand this conundrum? I'd love to know. Leave me a comment or question in the comment sections below. And if you're getting value out of my videos, please follow, subscribe and turn on notifications. And I will see you in another video.